This patient was sent to us at 28 and 1 with a diagnosis of a VSD and an abnormal 3-vessel tracheal view. And so we'll start out with the orientation of this case. As we do at our institution, we place the transducer on the maternal abdomen in a sagittal format with the transducer index marker at maternal head, 12 o'clock. And then at this point, we rotate counterclockwise 90 degrees to this transverse, initially abdominal view here, just below the diaphragm. Here is left, this is right, this is the spine, this is anterior, and you can see the stomach bubble and the spleen behind the stomach, and then the mass of the liver, which is mostly on the right. There's the IVC, and here is the aorta. And we transition more cephalad on the fetus as we watch the hepatic veins drain the IVC and then drain into the right atrium here. Now here we have the 4-chamber view, and we can see both atrioventricular valves. We identify this as the right ventricle, which is on the right and more anterior, based on this trabeculated apex with a moderator band, and then the morphologic left ventricle with the smooth septal surface, fine trabeculations, and these two papillary muscles here along the free wall. And so this is a mitral valve, and this is a tricuspid valve. And in this view, it looks like the ventricular septum is mostly intact. As we sweep more toward the outflow tracts from that 4-chamber view, you start to see this large subarterial VSD here, which is really more of a posterior malaligned VSD, because this part of this outlet septum or conal septum is deviated posteriorly into this subarterial region. And so this is going to be an outflow tract here. Again, this is the mitral valve with connections to these papillary muscles along the free wall. And as we sweep more cephalad, we see that that outflow tract turns into a great vessel. And then the other outflow tract, RV outflow tract here, giving rise to this semilunar valve there. So this is another outflow tract. And immediately there's a bifurcation of this vessel. So we can guess or surmise that this is the main pulmonary artery with a pulmonary artery bifurcation. And as we have swept just slightly more cephalad, we see that that other vessel turns into this circle, and we can gather that that's likely the ascending aorta. Again, this vessel here, this looks like the left pulmonary artery, that looks like the right pulmonary artery here, and so we have pulmonary artery and aorta, and then this vessel here is the SVC. So this is a 3-vessel view. And you can see the azygous vein draining into the back of the SVC here. Again, this is the spine, and this is anterior, left, and right. And so now we'll just summarize our connections in situs. And so again, this is posterior, the spine, this is anterior here, this is left and right. And so the apex of the heart is pointed leftward. So this is levocardia. You have the morphologic left atrium, which receives the pulmonary veins here. That connects normally to the left ventricle, so that's a concordant connection. And then that left ventricle gives rise to the aorta via this left ventricular outflow tract, and that connects concordantly to the LVOT, the aorta, and that aorta is coursing rightward. And as we look at the right heart connections, you can see that the right atrium connects normally to the right ventricle. And so as we transition to the right ventricular outflow tract, that right ventricle then connects to this morphologic pulmonary artery. And so that is a concordant connection as well. And so we have normal cardiac connections. Now, a more isolated cephalad swept three-vessel view here. This is going to be swept more cephalad to the three-vessel tracheal view. And here is the trachea. That's actually the carina where you have the bronchi bifurcating. So this would be the right bronchus. The left bronchus would be going this way, but we've transitioned past that point. And so as we go more cephalad, that structure turns into a circle, which is the trachea. And so we have the three-vessel tracheal view here. The difference between the three-vessel tracheal view and the three-vessel view is that you have the pulmonary artery bifurcation, and you don't quite have the trachea. You have bronchi in this at this level. And so you have the three-vessel view where the SVC, the ascending aorta, and then the pulmonary artery, and you have the pulmonary artery bifurcation here, and you do not see the ductus arteriosus. Moving forward, three-vessel tracheal view, you have the three vessels, SVC, aorta, pulmonary artery, ductal arch, ductus arteriosus, and here's the trachea. And as we sweep more cephalad, you should see a V form. Either the ascending aorta will go to the left of the trachea and connect with the ductal arch here and create this V appearance, or the aorta will go to the right of the trachea in the course of right-sided aortic arch and connect with the ductal arch back here, creating a U shape. And so either way, the aorta should connect with the ductal arch. And as we sweep more cephalad, you see the ductus and the main pulmonary artery transitioning out of the picture. Ascending aorta keeps going up, and there is not a connection here. And so you still see the SVC, but you see these vessels, that aorta bifurcates into two vessels here. And so these two vessels here and here, these are the innominate artery and the left carotid artery. And the reason why we know that is because that first vessel will bifurcate into this right subclavian artery here, and then that vessel will continue cephalad to become the right carotid artery. And this vessel moves more cephalad as well, becoming the left carotid artery. And now we'll do this at speed. I might even slow it down just a little bit for you to train your eye on these two vessels that then this first vessel bifurcates. Again, this is the trachea, SVC. This first vessel bifurcates into the innominate artery, right subclavian, right carotid, and we lose sight of the main pulmonary artery and ductal arch. This is actually the innominate vein as it transitions, and if you watch where the SVC starts here, you'll see that innominate vein come across and originate from the left side of the chest here. Placing color on that picture, you can see the flow through the ductal arch in the right direction, the correct direction. Again, this is the innominate vein. This vessel is draining from the left toward the SVC, and so it's red. And those vessels that continue up bifurcate here, as previously stated. This is the right subclavian artery. Right carotid will originate here, and then the left carotid will be here. And we do not see a connection with the aorta and the ductal arch back here. Again, another nice sweep showing that. And you just start to catch this last vessel here, which is the left subclavian artery originating from the descending aorta past the ductus arteriosus. And so this is looking more like a type of interrupted aortic arch, and likely type B based on what the branching pattern looks like. Now we want to move back down to the four-chamber view and evaluate the outflow tracts. And here we're seeing that left-sided outflow tract, the LVOT here is quite narrow and not quite picking up the aortic valve leaflets yet. As we move forward, you start to see the aortic valve here. Again, this is that subaortic posteriorly deviated conus tissue, and the aortic valve annulus, aortic root, and ascending aorta are all somewhat hypoplastic. And so here we get a nice close-up view, frozen, of the aortic valve leaflets closed, and you can see just how narrow that subaortic region is. And then here in motion, you can see the aortic valve leaflets opening during systole and just how narrow that subaortic region gets. Another really good look at that in this view here. We take the standard approach to look at the pulmonary veins draining into the left atrium. Normally here you can see the flap of the foramen ovale bowing appropriately into the left atrium there. Pulmonary venous tracings appear normal. And then a more upright orientation of the four-chamber view to look at the inflows and the outflows and the appropriate angles. And here we have the mitral valve inflow and then the aortic valve outflow, and you can see just a slight amount of flow acceleration in this region of the left ventricular outflow tract here. So we'll evaluate that. Mitral valve inflow pattern appears normal. And then this is the aortic valve outflow here. And you can see that the velocity is just at the upper limits of what we would call normal for this aortic valve. Nice look at the tricuspid valve inflow, just a little bit of tricuspid regurgitation there. Better look at that. And then the tricuspid valve inflow pattern is mostly monophasic, but there is a slightly elevated heart rate, so that's not abnormal to see that. Now we're using a lower frequency transducer, and this tends to give us a better color signal. Color Doppler appears to be functioning a bit better with this lower frequency, and so we can see the branching pattern of that, the arch vessels here, where you have the innominate artery here, bifurcating from the right carotid into the right subclavian artery here, and then even the vertebral artery you can see coming off, and then the left carotid is here, and as we stated at the beginning of this, you can actually catch a glimpse of that left subclavian here arising from the descending thoracic aorta past the ductus arteriosus. And then here we have a nice slowed down axial upper chest view, three vessel view shown here, SVC, aorta, and pulmonary artery bifurcation again. And then as we put it in motion, you can see the ductal arch, ascending aorta here, and then the bifurcation of that vessel at the top of the sweep. So again, all the structures that we're seeing here, you're seeing trachea, SVC, this is an innominate vein coming across ductal arch, and then this vessel is the aorta bifurcates into the left carotid and right innominate artery. And you're even seeing a vertebral artery here, coming off of that subclavian artery as it goes that way. Now, as we transition to our sagittal views through the fetus, we start to see spine posteriorly here, and this is a really nice short axis view of the ventricles. And at the end of that sweep, you can see more toward the base of the heart, you can see this large subarterial VSD, this large posterior malalignment VSD. You're seeing the RV inflow here with the tricuspid valve, and then the RV outflow tract with the pulmonary valve here. And so that's a nice transition toward the RV outflow tract, showing the pulmonary valve and part of the main pulmonary artery there. Another good look in this view to sweep for ventricular septal defects. You can see the two papillary muscles in the left ventricle associated with the mitral valve. And you can see the mitral valve here en face and the tricuspid valve here. And then at the end of this sweep, very rapid sweep, we see the flap of the foramen valley. This is the plane of the atrial septum, and you can see the opening of the foramen valley here. The flap is appropriately in the left atrium there. And now with color Doppler, we use a low scale color Doppler and we sweep down the base of the heart from the base of the heart to the apex using color Doppler along the septum here, keeping the septum within the color box. And we do this sweep from the apex up to the base and back down to the apex. Again, low scale color Doppler to elicit any type of ventricular septal shunting. And here you see shunting through that ventricular septal defect that we saw earlier is bidirectional. Now, from that short axis view at the ventricular level, looking at the ventricular septal defect and ventricular septum and AV valves, we can sweep more cephalad to look at the outflow tracts. Again, this is the RV outflow tract and the main pulmonary artery here. This is the LV outflow tract subaortic region. Here's that ventricular septal defect, which is more in a perimembranous but posteriorly malinserted, malaligned conal septum. And as we put that in motion, you can actually see the ductal arch forming here. And you start to see the airway here. This is the trachea. And then you start to see the ascending aorta here. And the ascending aorta looks like it goes straight toward the neck. It does not start to curve here. So at speed, you can see that these two vessels, the ascending aorta and the ductal arch, do not connect. Here's the ductal arch, there's ascending aorta, and there's no aortic arch that connects with the ductal arch. Again, that's the trachea there. And so this is important because this is one of the main views, the key view to prove or disprove interruption of the aortic arch. The ascending aorta is significantly hypoplastic, and if we saw a transverse aortic arch, I would suspect it would be also significantly hypoplastic with a coarctation, but we're not even seeing a connection of that ascending aorta or arch with the ductal arch. And so we'll try to do several of these sweeps just to confirm or disprove the fact that there is interrupted aortic arch. Here, a really nice look at that ductal arch here at the end. Nice hockey stick looking appearance. And then again, ascending aorta. And this is the point at which there is not a connection between the aorta and the ductal arch. There is no aortic arch here. So still trying to see. This is a transition slightly between the bicaval view here with the SVC into the right atrium. Again, the ascending aorta is right next to that. And then as we apply color Doppler, again, we have a very wiggly baby. You see a couple things. And so we see this red flow here. This is actually the SVC. This is the azygous vein, a normal structure that drains more cephalad toward the SVC and connects to the SVC right above the right pulmonary artery, just above the right pulmonary artery and right bronchus. And here you start to see the ascending aorta and then the ductal arch There again is the azygous vein draining to the SVC. There is ascending aorta with a carotid artery, a left carotid artery there. And then as we walk this forward, we see the aorta go straight up to the carotid artery. There's the airway. And then here is the ductal arch. Again, the flow is this way, and so it's transitioning through the ductus, and we do not see a connection from the ascending aorta to the ductal arch. So this is aortic arch interruption. A couple more focused sweeps in that same region with nice color Doppler application here. Again, that left subclavian artery is the last vessel, and here you can see a little red flash with that coming off just distal to the ductal arch there from the descending aorta. And again, it's appropriately going toward the left shoulder. And then just finishing up with the rest of the exam, here's a nice bicaval view. Again, there SVC, IVC lining up nicely with the descending aorta here. Here, nice intact IVC. And then some color Doppler on the DV, and the rest of the exam is unremarkable and otherwise normal besides the cardiac defect of interrupted aortic arch type B with a large posterior malalignment VSD. Thank you all so much for watching this presentation, and I hope to bring you many more in the future.